Hi, welcome back to my channel. Let's see some of the quick important concepts about coronary heart disease. Coronary heart disease, that is CHD. First we have to know about the main definition of coronary heart disease. Definition. The main definition of coronary heart disease. It is defined as a impairment of function of the heart. It is defined as the impairment of function of the heart due to inadequate blood supply to the myocardium. Inadequate blood supply to the myocardium. Inadequate blood flow to the myocardium as a result of obstruction in coronary circulation. Coronary heart disease is also called as modern epidemic. Here, first, the coronary heart disease. It is defined as the impairment of the function of the heart due to inadequate blood flow to the myocardium as a result of obstruction in the coronary circulation. Coronary heart disease is also called as modern epidemic. Here the main important point is inadequate blood flow to the myocardium. Inadequate blood flow to the myocardium. That is very, very important. And next, coronary heart disease may itself manifest in many forms. Coronary heart disease manifests itself in many forms. The first one is angina pectoris. The first one is angina pectoris. The second one is MI, that is myocardial infarction. The first one is angina pectoris and the second one is MI and the third one is chronic ischemic heart disease. Chronic ischemic heart disease. And the next fourth one is sudden cardiac death. Before going to discuss about these subtopics, first of all we are going to see about the coronary heart disease. Is also called as the first one is coronary atherosclerosis, and the next one is coronary arteriosclerosis. The first one, coronary atherosclerosis. The definition of coronary atherosclerosis. Coronary atherosclerosis. It is the abnormal accumulation of lipids. It is the abnormal accumulation of lipids or fatty substance or arthromatous plaque or fatty substances or fatty erythroma. That is plaques, arthromatous plaques. In the lumen of the coronary arteries. Here, first, coronary heart disease is also called as coronary atherosclerosis and coronary arteriosclerosis. Coronary atherosclerosis, it is an abnormal accumulation of lipids or fatty acids. Next one, fatty substances or fatty erythromas, that is arthromatous plaques, in the lumen of the coronary arteries. As I told before, first of all we are going to discuss about, otherwise I will tell about these risk factors. The main risk factors is low density lipoprotein, and the second one is high density lipoprotein, and the third one is cigarette smoking. Third one is cigarette smoking, and the fourth one is hypertension. These are the main risk factors of coronary atherosclerosis. And here we are going to discuss about angina pectoris. Here, first of all, we are going to discuss about the angina pectoris. The main first definition. In angina pectoris is an intermittent chest pain. Intermittent chest pain caused by transient reversible myocardial ischemia. Here, angina pectoris. Angina pectoris is an intermittent chest pain caused by transient reversible myocardial ischemia. Here, transient reversible myocardial ischemia. There are three types of angina pectoris. The first one is stable angina. And the next one is Prince-Metal angina. Prince-Metal angina. And the third one is unstable angina. These are the three types of angina. Stable angina is also called as typical angina. And Prince-Metal angina is also called as variant angina. And unstable angina is also called as crescendo angina. Here, first of all, we'll discuss these three subtopics. First one, that is stable angina. In stable angina is most common. In stable angina, the patient will have episodic chest pain. Here in stable angina is most common. As I told, it is a predictable episodic chest pain associated with particular level of exertion or some other increased demand. That is, in increased demand you can say as emotional stress. Here that is episodic chest pain and exertion. This stable angina. In the patients who is suffering from stable angina, the PQRST with the ECG wave ST segment depression will be there. ST segment depression will be there. The main drugs used in stable angina, that is nitrates, and first one is nitrates and the second one is CCB, that is calcium channel blockers. Calcium channel blockers, such as amlodipine, nifedipine, nicardipine, etc. And the second one is Prince-Metal angina. In case of Prince-Metal angina, the patient will occurs pain only at rest due to vasospasm, coronary vasospasm. In Prince-Metal angina occurs at rest and is caused by coronary artery spasm. This coronary artery spasm is very, very important. Here the main clinical manifestation is rest. And exercise. And the main drugs treatment of choice drugs is nitrates, and the second one is beta blockers. The drugs nitrates is given, but in case of Prince metal angina, beta blockers is contraindicated. We should not give beta blockers the patient who is suffering from Prince metal angina. The third one is unstable angina. Unstable angina is the most dangerous type of angina. Most dangerous. Here, the high risk of progression of MI. In unstable angina, it is associated with plate disruption and superimposed thrombosis and distal embolization of thrombus or vasospasm. This is the definition of unstable angina. The unstable angina is associated with plate disruption and superimposed thrombosis distal embolization of the thrombus and or vasospasm. Here, the associated with plate disruption and superimposed thrombosis. Unstable angina is the most dangerous angina. The high risk of progression to MI. Those people who are suffering from unstable angina, there is a high risk of progression to MI. They are associated with plate disruption and superimposed thrombosis, distal embolization of the thrombus and or vasospasm. Here the main drugs used for unstable angina is antiplatelet drugs. Antiplatelet drugs. Antiplatelet drugs. Thank you.